My name is Precious Amiewalan. Thank you, Julia. And today I will be talking about race in clinical algorithms and their use in medical decision making. And I would like to thank my advisor, who isn't here right now but is watching remotely, Dr. Elaine Soisi, who has helped me throughout this whole project and encouraged me to keep on going. So suppose someone wanted to know the risk of having heart disease, and this person is new to a particular city and is waiting to see their provider. The person is slightly nervous and just thinks of their family back home who is unwilling to seek help and seek medical help. So they're at their appointment and they're asked of their age, race, and habits. And this is confusing for the person because they're Afro-Puerto Rican and most of their family is pretty diverse. So they ask, why does my race and all this characters matters for my visit? I just want to know if I'm healthy. Well, heart disease is the leading cause of death in the United States, and some racial and ethnic groups have higher risk of heart disease. And the information gathered can be used to predict your risk as well as other health risks. And so for my Keystone project, I really wanted to know how race is used in medical decision making, and more specifically, how race is used in clinical algorithms. And when I talk about clinical algorithms, they're like a calculator that you input information in and it spits out like an answer percentage depending on what it's talking about. And I wanted to know if this can be discussed more in healthcare settings and how, or if this can be made simply and more used for the public. So what is a clinical algorithm? It's a set of steps that clinicians use as a guide to help them in preventative services. It's supposed to help alleviate the load when talking about clinical healthcare. And for my project, I really wanted to create a website, this is not mine, for like all the algorithms that use race and is embedded into it. But in the fall of last semester, I found that this website was created, so thankful to these people who were able to create this database because nothing like this was here before. And so the website, Clinical Algorithms with Race, it's a useful database. I recommend you guys look at it. It has 3 different sections: risk calculators, laboratory tests with like therapy recommendations, the top left, and then medications that have race-based guidelines, as well as devices with racial performance. And so in this website and database, there's 9 different specialties and 46 are clinical algorithms that use race. And on the graph with the left, it shows that obstetrics is the most with like on this particular database, but that's including both US and UK based studies. And then what I did was I went to each study individually and looked at their pool of cohorts that they used to create their studies, and cardiology has the most patients that were used to study. And so when it comes to risk calculators, they can either increase or decrease your risk of having some sort of disease. So it depends on how many people were in the original study and then what they were trying to get as the outcome. And so remember the story I told you earlier about the person who wanted to know about heart disease? Let's say the provider wanted to see the risk of having arteriosclerotic cardiovascular disease, but we're going to go with ASCVD for short. And this is a prevention tool to try to see the risk of people who haven't had ASCVD. But with this calculator, South Asians, Puerto Ricans are underestimated for having heart disease, and then Hispanics and East Asian ancestry are overestimated. And this is an example of what most of the calculators look like that have like race embedded into it. You can't figure out the risk score of your health without it, and most of these are public use websites. So it was just something interesting that I was noticing and learning about it. And so this risk calculator is supposed to predict your 10-year likelihood of having this disease, and let's say you get it 2020, 2030, but it doesn't actually show that you're getting treated for these recommendations, even though you're at high risk. And so another moment where race is being used in clinical algorithms is for laboratory tests for anemia in pregnancy. And anemia occurs when there is like few red blood cells, and it increases your chance of having premature birth. And treatment is recommended for all women in 1998 for who have at a certain level during their third trimester for treatment. But for non-Black women, the level is increased to where they are, let's say you have more red blood cells counts. They're more likely to get treated for anemia during pregnancy than Black women who have the same level. And until 2021, this 1998 guideline was changed to being race-free during the third trimester. So it's really just interesting that 23-year gap. And this is what all my project has been about, just trying to learn all these different studies and see how race is used and how can I really push it into something small. And anemia is the most common blood disorders, but it affects Black patients more than other racial groups. So this was something that it was contradictory to have the CDC and other known organizations have this as a recommendation. And since race in algorithms feeds that idea of race being a biological factor into healthcare, and it perpetuates the systemic racism that we have in our healthcare system, and which can lead to more racial and ethnic biases in healthcare. And so for medicine, I am pre-med, so I really just wanted to bring this personal aspect into everything. So I drew these photos because I wanted to bring them to community health centers and have some sort of video to teach people about different parts of medicine and just get people more interested in wanting to learn more about their health, and just have something where it's more as a future physician, of course, I want to be able to talk to my patients in a way that they really just understand what their health is seeking and all the questions that are asking. And I'm hoping that towards the future, we really just see more changes in medicine, and instead of putting race, putting what the root causes of all these illnesses and diseases are when putting into calculators. Yeah.
Thank you, Precious. Excellent work. We will now be taking any questions.
Thanks, Precious, for this presentation. I learned so much from your research this semester. As these algorithms are still sort of being improved and we're still trying to figure out how to sort of take racial bias out of them, what would you recommend to that man from the opening story who wants to learn about his heart disease risk? Would you tell him go to your doctor and sort of run through these calculators and take them with a grain of salt? Or what do you think are things patients should be thinking about right now?
I think patients should always ask questions when they go to their healthcare visits, and something to not be you go there, you go in, you get out, the same way you feel a healthcare appointment is 15 minutes. So you want to really be proactive about your own health, and also to ask your provider to reciprocate that back to you, because it's something where it's a two-way street. If you're feeling your provider isn't giving you clarity in your healthcare visits, or you don't understand how you as a person is affected by the system, if you're able to, I recommend switching providers and just finding ways that you can advocate for yourself. But I also, for him, I would tell him that he was anxious about his family members and other things. I think going to the doctor's office is a learning experience that I can bring back home to my family members. So if I learn something new, I'm at risk for this or because of my race, I just use that as a way to get my own family to get more healthcare checkups, and also know what it means. Not just go in there just for vibes or because Precious said, go get checked up. Yeah.
Thank you, Precious. I also learned a lot from your research. So you were looking at algorithms that are used in different areas of medicine.
Yes.
Did you notice anything, any kind of differences or patterns or just things that jumped out looking across those different areas?
So in some of these studies, they use race as a factor, but don't really show in detail what the participant pool is. So it's more of that's my hatred of it with the research side because it's not really good research, and some of them don't even acknowledge the racial disparities within their industry and just use race and say like, oh, it's been validated, and not all of them are validated. One interesting thing that I found is like a particular study didn't have the demographics for like 300 participants, so they used another algorithm and other like factors like family history and like where they're from to create ethnicities for those people. So they didn't actually give the people the option to like vocally say like, I'm Japanese. They like used another algorithm to be like, we think these like 38 of them are Japanese, like putting that into that pool. So just like you really see and all this algorithm work, it's not really regulated by the government. So you really just see that when you're reading these essays.
Thank you, Precious. This was a great presentation. I was just thinking about like a major issue in like healthcare as like incoming medical students have these kind of like pre-existing racial biases, and a lot of like education of medical students don't include like kind of taking out that type of bias. So would you think like this database could like help or harm like incoming students learning to like not be as biased?
I think it could help because before this doesn't exist, like you could say that there's race in medicine, but you can't really like quantify and put it down. So it gets you to think like, oh, this is something like I don't have implicit bias, that type of thing. And also with those types of trainings, usually though, they're put at the end of the day and something that not everyone wants to listen to. But it goes more than that. We're getting just more people of color into medicine to show that these experiences do exist, where like people are scared of going to the doctor because there is no communication, and just like teaching your friends. Yeah.
Thank you, Precious.